Well, you get a diagnosis of breast cancer. Your first feeling is fear and then wanting to get the treatment over with. But now some doctors are saying maybe not. As Roseanne Tejas reports, there's a new approach called watchful waiting.
After a routine mammogram 3 years ago, 52-year-old Barbara Mann was diagnosed with ductal carcinoma in situ, the earliest form of breast cancer.
The initial reaction was, get this out of my system.
DCIS accounts for up to 25% of breast cancers. Mastectomies or lumpectomies have become the standard treatments.
How are you?
Surgeon Laura Esserman is considered a pioneer of the active surveillance or watchful waiting treatment for breast cancer. She monitors patients with low-grade DCIS with screenings and medication for 6 months without surgery.
Part of the personalization of medicine in breast cancer is not just to do more for those who need it, but to do less for those that don't.
If DCIS shows little or no growth, patients can avoid more aggressive treatment, which has worked so far for Barbara.
It just was an immense relief.
A study published in JAMA of more than 100,000 women with DCIS found aggressive treatments do not reduce breast cancer mortality rates.
When time is not of the essence, when it's not an emergency, you can offer different options and you can give people a chance to kind of get a better sense for, well, how is my tumor behaving?
But the American Cancer Society says studies suggest about 1/3 or more of DCIS cases will progress to invasive cancer if left untreated. The challenge is pinpointing which types of DCIS are most likely to worsen. Kristen Orianta's mother died from breast cancer, and Kristen knew she was at high risk when she was diagnosed with DCIS. Watchful waiting was not for her. She chose a double mastectomy.
I don't have to go in for this every 6-month active surveillance and have the worry and the anxiety and the stress of, am I going to end up like my mom?
Dr. Esserman's approach is controversial, but she hopes it will lead cancer treatment into a better future. Roseanne Tejas, CBS 2 News.
There are 60,000 women every year diagnosed with DCIS. Dr. Esserman says they should consider all of their options, including joining clinical trials.